Why are nurses making all this noise? We're worried about you, the community.
We've come out today in response to the government's offer of a 1.04 wage increase and the rejection of safe staffing ratios.
They called on working people of New South Wales to stand up and keep this country going. And now they throw this pissily little bit of money in your lap and ask you to continue to be there for them.
We are tired of being told we're heroes, that everyone is so thankful for our service during the pandemic, only to be told in the next breath that we are undeserving of a pay rise that keeps up with inflation.
1.04%. They might have given you 1.5, except they want you to pay for your own superannuation increase.
Just disappointed, really, but not surprised.
Something doesn't happen, we're either going to get a lot of nurses leaving the profession, or we're going to have a lot more, poorer outcomes in the hospital settings.
Legislated nurse-to-patient ratios save lives, save money, and increase nurses' job satisfaction. We know this because nurses in Victoria and Queensland have ratios. Studies found during the first 3 years that ratios were introduced in Queensland, they prevented 145 deaths and saved $81 million.
Give us what we really want, which is ratios, 1 to 3 in ED, 1 to 4 on the wards. Keep everyone safe.
What do you want?
Ratios!
When do you want it?
Now!
A 1.4% offer of a pay rise to the people that work to get us through COVID is an absolute insult and a disgrace.
What do we do? Stand up, fight back!
It doesn't have to be this way. The New South Wales government has the power to help nurses and midwives, and the only way to make sure the New South Wales community receives the absolute best care is by supporting nurses and midwives through safe staffing by implementing shift-by-shift ratios.
We jumped through hoops with being redeployed, working in the vaccination clinics, in the testing facilities, and none of us have been rewarded for any of our hard work. Now they have offered 1.04, which is absolutely disgusting.
So we've asked for a 4.7% increase. It would make up for what was lost last year and simply match what was the government's commitment over the last 10 years of 2.5.
It just shows they don't care. They don't care for nurses. I work mainly night shifts, and it could be 1 to 4, 5, 6, 10 because we're working on skeleton staff. Some nights we work 12-hour shifts with no break.
It's like an elastic band, you can only stretch us so far before we break, and we're the backbone of healthcare.
What do you do? What do you do?
Nurses are burnt out. Nurses need to feel that they're appreciated. The New South Wales state government has done nothing more than give us a pat on the back and told us to go on our way.
If they want a quality health system in New South Wales, nurses and midwives must have the staff they need to provide the care, and we deserve a decent pay increase.
We call on the New South Wales government to reconsider their pay offer to us. And most importantly, it's time for us to have shift-by-shift ratio mandated in our ward.
If you haven't got enough staff, you're finishing work exhausted and without thinking that you've done your work to the best of your ability.
We need proper funding for our services, we need ratios in our emergency department, we need ratios in our acute care wards, and we also need some remuneration for the amazing and the hard work that we do. Gladys, show us what you're made of.
Nurses are standing out here on the outside, there's something awfully wrong on the inside.
I've worked for 43 years as a nurse and I've not seen it this bad.
This government can afford to look after nurses and midwives. They just see us as one big bill. Too bad they can't work us into the ground because it's a big bill.
I've just had a young boy tell me today that he's working as a new grad and he's been forced to do overtime 3 times in a week. They're at risk of losing their registration because what they're asking them to do is unsafe.
We're getting patients from all over top end of New South Wales and beyond. So we just can't sustain it. It's just impossible.
They spend like $500,000 in 13 months on overtime and tell us that that's the safest way to staff a unit. It's really wrong. We want more nurses. We want to be able to do our best. And if they can give it to them in Queensland and Victoria, why can't they give it to us?